Hi, my name is Lori Miller, and I'm your guest lecturer today. Today I would like to talk about MRSA, what it is, how to prevent it, how to treat it. What is MRSA? MRSA stands for methicillin-resistant Staphylococcus aureus. It is a form of staph infection which does not improve with treatment by first-line antibiotics. It is considered resistant because it does not respond to these antibiotics. Antibiotic resistance is part of a larger class of biological problems called antimicrobial resistance. These can include, in addition to bacteria, microbes, viruses, and fungi, molds. Often due to overuse, these microbial organisms have developed and adapted to the treatments such as antibiotics are no longer effective. How did MRSA originate? MRSA originated due to the overuse of antibiotics. Staph was discovered in the 1880s, though it has no doubt been around well before that. By the 1940s, the discovery of modern antibiotics led to the widespread use of penicillin as a treatment for staph infections. However, by the 1950s, staph became resistant to penicillin and other antibiotic. Methicillin took its place. By 1961, a British researcher found the first case of methicillin-resistant staph infection. In fact, MRSA is resistant to a whole class of antibiotics called beta-lactams. This class of antibiotics includes penicillin, amoxicillin, oxacillin, methicillin, and others. Risks for MRSA. Risk factors for MRSA include being hospitalized, having a weakened immune system, engaging in organized athletic activity, living in filthy or dangerous conditions, and IV drug use. In addition, institutional settings like prisons, military bases, school daycare, and nursing homes have become sites where MRSA has appeared. Hospital-acquired MRSA was the primary form of the disease. Today, cases of community-acquired MRSA are becoming more numerous. Drug users, especially IV drug users, are at special risk because of the use of contaminated needles. These may easily pick up staph germs from the skin. One survey found that in poor areas, up to 22% of people were colonized with MRSA, and IV drug use was a primary risk factor. IV drug users were 10 times more likely to be colonized with the general population, and 1/5 of them had abscesses or cellulitis. There is little evidence, however, that MRSA has any connection with undiagnosed mental illnesses, though one could speculate that there is a higher incidence of undiagnosed mental illness in poor areas and in IV drug users than in the general population. On the other hand, MRSA can be a cause of mental confusion. Another important risk factor is participation in organized athletics. There have been several well-known cases of MRSA in athletic teams, most notably football. Symptoms and progress of MRSA infections. MRSA infections usually start as a red spot or just sore like any staph infection. These swollen, painful red bumps can look like pimples or spider bites. Important concerns are raised when the swollen areas feel warm and have a lot of pus. In addition, they are generally accompanied by a fever. Sometimes these infections will be confined to the skin and become boils. They become more dangerous when the infection penetrates into the bloodstream and can damage major organs. How does MRSA spread? MRSA is spread generally by skin-to-skin contact. Most people have staph organisms on their skin, but they do not cause any major problems. However, these people who are colonized by the bacteria can spread these bacteria to others. For the most part, MRSA infections have occurred primarily in people with weakened immune systems and was mostly found in hospitals. It is thought that these infections were transmitted by doctors and nurses. This is changing. Healthy adults can also get MRSA, and increasing or contracting it, especially in athletic settings. How is MRSA diagnosed? The first step in diagnosis is to take a sample of tissue from an infected site to see if it is Staphylococcus aureus. If so, there will be further tests to see what antibiotics will be effective. Sometimes a sample of nasal tissue will be tested for drug-resistant strains. Usually the sample is grown in a petri dish, which takes about 48 hours. But there are newer tests that can determine the DNA of a sample more quickly. How is MRSA treated? The first line of defense is non-antibiotic. Generally, this means draining abscesses and boils. There are often sufficient in cases of mild or moderate MRSA. To avoid any other problems, this should be done by a physician or other healthcare provider. Antibiotics are only recommended for severe cases. The antibiotic of choice is intravenous vancomycin. Obviously, this would mean a hospital stay. Antibiotics are only recommended for severe cases. The antibiotic of choice is intravenous vancomycin. Obviously, this would mean a hospital stay. Epidemiology of MRSA. Epidemiology refers to the branch of medicine that deals with the incidence, distribution, and possible control of diseases and other factors relating to health. It consists of both individual factors, local or national factors, and temporal ones. In short, how often diseases occur in populations and why. Individual occurrence. MRSA is found most in the very young, under 2, and very old, over 65. If you have had a recent flu infection, you are most vulnerable, and if you live with someone with MRSA. However, in the case of community-acquired MRSA, many individuals seem to have no risk factors. Certain populations have been susceptible to community MRSA outbreaks. Outbreaks have been reported among men having sex with men, medically undeserved individuals, military recruits, prison inmates, athletes, postpartum women, individuals who use intravenous drugs, and heterosexual couples. The latter apparently included shared razors. Healthcare facilities are also sources of community-acquired MRSA. Regional variations appear in the U.S. and Europe. The southern U.S. has a higher incidence of MRSA than the rest of the country. Iceland has a very low incidence of MRSA, and Greece has the highest in Europe. Global outbreaks since the late 90s have occurred not only in the U.S., but New Zealand, Saudi Arabia, Latin America, Australia, India. Strategies of prevention. Primary prevention. This refers to approaches that seek to prevent the onset of specific diseases via risk reduction by altering behaviors or exposures that can lead to disease, or by enhancing resistance to the effects of exposure to a disease agent. They aim to intervene before the disease or agent enters a host. Regular hand washing is considered one of the most important primary prevention strategies. In institutional settings like prisons, hospitals, nursing homes, and schools, care has to be taken to clean and disinfect common areas and surfaces that are commonly used. Secondary prevention includes procedures that detect and treat preclinical pathological changes and thereby control disease progression. It aims to catch disease at the earliest possible time. Screening procedures, such as mammography to detect early-stage breast cancer, are often the first step, leading to early interventions that are more cost-effective than intervening once symptoms appear. Prompt examination and treatment by health professionals soon as symptoms appear. Both individuals and health practitioners and institutional authorities need to be educated about the signs and symptoms of MRSA. Changing dressings and disposing of them safely and keep the wound area clean are important. Other close contacts, such as family members, should also be examined. These measures are even more important in institutional settings. In these settings, additional precautions should be taken. These include separation of the patient from others, limitation of visitors in prisons, and additional sanitation measures. Tertiary prevention. Tertiary prevention seeks to soften the impact caused by the disease on the patient's function, longevity, and quality of life. Tertiary means SUS can include intravenous antibiotic treatment with vancomycin or other potent antibiotics to which the bacteria is not yet resistant. Medical procedures such as cleaning out the infection or even amputation, and if needed, isolation of patients. Current research and controversies. Drug resistance and antibiotic overuse in animals, a possible source of transmission. Problems of drug resistance are a growing problem in treatment of infectious diseases. Numerous diseases have become resistant to common antibiotics. Drug resistance has often been seen as a result of overuse and overprescription by doctors. For example, antibiotics are often prescribed for routine ear infections in children where this does not really seem needed. However, a growing concern is the use of antibiotics in farm animals in order to produce a higher yield and to hurt animals in more crowded conditions. Drug-resistant bacteria that is developed in animals can spread to human populations, making treatment more difficult and risky. Some studies have tried to discover the extent of spread of drug-resistant forms of MRSA from animals to humans. Livestock-associated MRSA has been identified in the Netherlands, the U.S., and in Canada. One study of Canadian pig farms showed that MRSA was common in pigs on those Ontario farms and on farms in general. 45% of farms had MRSA, and MRSA about 25% of pigs and 20% of farmers. The same strain was found in humans and pigs, lending support to the idea of an animal-to-farmer transmission. MRSA in sports settings, a growing problem. A recent case in the news illustrates the dangers of MRSA transmission in sports settings, which is an emerging new problem area. In October of this year, New York Giants tight end Daniel Fells had a serious MRSA infection following a cortisone shot to his ankle. The infection had spread to his bloodstream, producing a high fever, and he faced possible amputation and even death. Luckily, he has recovered with treatment, but his football career is likely over. Athletic settings are increasingly places where MRSA spreads. Several football teams have seen outbreaks, including the Cleveland Browns, Washington Redskins, and St. Louis Rams, as well as several NBA players. Contact sports are considered areas in which MRSA spreads due to close skin-to-skin contact, which can spread bacteria to small skin abrasions that occur in these sports. In addition, shaving body hair, especially genital hair, seems to be a factor. However, unsanitary conditions in locker rooms and gyms is also a factor. Protective gear, soap, and towels, if insufficiently sterilized, can spread infections, as can unclean surfaces. The use of bleach for towels and uniforms, individual soap dishes, and the use of antimicrobial mist should be adopted, and all cuts and scrapes should be immediately treated with rubbing alcohol. Surfaces should be disinfected daily. Other institutional areas like prisons and military institutions, daycare centers, and long-term health care such as nursing homes are also considered at risk. Community transmission versus hospital transmission. Predictions for the future of MRSA. MRSA was first identified in hospital settings and seemed to take hold in those with weakened immune systems. Increasingly, MRSA is found in healthy individuals in the community setting. This form of MRSA had been associated with the strain USA 300. In contrast, the primary strain of HA MRSA has been USA 100. Some studies have claimed that the CA MRSA strain is becoming more prevalent in hospital settings. One study in California found that almost half of all hospital admissions in a local hospital were due to CA MRSA. Another study at an Atlanta public hospital found that 34% of the cases were USA 300, while only 29% were USA 100. Most of the rest were USA 500. The authors believe that this shows that the CA MRSA is becoming a major source of problems in hospitals. One theory is that IV drug users are a major reservoir of the CA MRSA strain, since most of the IV drug users who carry MRSA have the USA 300 strain. Given the likelihood that IV drug users and HIV-positive IV users will be hospitalized, they speculate that this could be a major route of transmission of CA MRSA to hospital settings.